Hello, welcome back to Simply Women's Health with CeeJay. Today we're going to talk about week 19 of your pregnancy. You are almost halfway there. At this point, your fundus, or the top of your uterus, is just below your belly button. If this is your first baby, if you are tall, if you are plus size, if you are athletic, you may not have a bump just yet, and that's perfectly normal. If this is not your first baby, if you're carrying more than one baby, if you are short in stature, you may very well have a bump. Very normal for you to have cramping. Those are called Braxton Hicks contractions. Twinges. Those are round ligament pains. Every time you make a sudden movement, you get a pulling sensation. Perfectly normal. Inside of that uterus, your tiny human is now measuring just over 9.5 inches from head to toe, or about 24 centimeters, which is roughly the same size as a dinner knife. The baby weighs about 9.5 ounces, 236 grams, or about the same as 2 eggs. This week, the baby's teeth are starting to develop. The baby is getting hair all over his or her body. The heart is beating 120 to 160 times per minute. Those kicks are getting much, much stronger. If you are not feeling those flutters yet, don't worry, you will be feeling them soon. So what are some other normal symptoms? Heartburn. As your uterus is growing, your stomach size is shrinking, and you actually have more stomach acids. Make sure you're eating small, frequent meals throughout the day. Milk products help, and avoid anything that's greasy or spicy. You may notice skin changes, all that estrogen. You can get some discolorations on your face. Those are normal. You may have a line that's developing on your tummy. That too is normal. Nosebleeds, because of all the progesterone, that too is very common. What is not normal at this point? Bright red bleeding that's enough to saturate a pad, cramping that won't go away, severe pain of any kind that is persistent. Those are all reasons that you need to contact your healthcare provider. So do you have a visit coming up this week? If you do, you probably are going to have your anatomy scan. That is a big ultrasound. It takes anywhere from 30 to 60 minutes. They're going to look the baby over head to toe. They're going to check out the placenta. They're going to check out the cord, make sure everything looks okay. If you haven't already had an alpha fetal protein drawn, they will offer that test. That is a time-sensitive test. It has to be done between 15 and 21 weeks to see if your baby is at increased risk to have what's called a neural tube defect. You're going to want to check your weight. Now, if you haven't gained any weight yet, that is absolutely fine. Normal weight gain in the first half of pregnancy is anywhere from 0 to 5 pounds. So what should you be doing at this point? I encourage you to eat a good, healthy diet. Make sure you're staying well hydrated. If you are thirsty, you are dehydrated. Take a prenatal vitamin, exercise, have sex, go on that vacation. Remember, you're not sick, you're pregnant. Live your life. Good time for you to start thinking about your birth plans. What do you want your delivery to look like? Start looking for those prenatal classes. If you're employed, talk to your employer about their maternity leave policies. If you have questions, I would love to hear from you. Please put them in the comment section below. While you're down there, you know what you need to do. Hit that like button. If you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CeeJay. I'm at your cervix.